So what we're going to do today is Lsvt, move big. We're trying to incorporate and calibrate better movement patterns for patients with Parkinson's disease. So Brian is going to be my patient, and I'm going to explain each exercise out of our 7 tasks that we can do. Brian, how are you doing today?
Doing well, thank you, Mike.
Okay, so I'm going to have you at the edge of your seat, and the first exercise we're going to do is we're going to start at our kind of our neutral position. And we're going to reach towards the floor, and then we're going to open up as large as we can. So we want real large movements. We're going to reach forward and up nice and big. So you want to also have your patients, if they have something to say, like they're counting, tell them to speak loud. So that was 4, and that's 5. We want them to use their diaphragm and to get them to speak louder as well, so we're kind of killing 2 birds with 1 stone. So we're going to do a couple more, and 1 more. How are we doing so far, Brian?
Good.
Feeling okay?
Feeling great.
All right, so we're going to check, make sure he's not too fatigued. So the next one I'm going to show you is we're going to reach to the side. So we're going to go. Okay. I want you to alternate it, go to each side. Yep. Good. Reach up as high as you can. Good. So we're going to be doing 10 reps for each side. Doing okay so far, Brian?
Doing great, Mike.
Are you still counting and keeping track?
Nope.
Okay. So this is where having the patients count out loud would help. So Brian, we're going to do 4 more to each side. Nice and big. 2, 2, 3, 3, 4, and 4. Good job. Doing okay so far?
Doing great, Mike.
All right. So that is the 2-part for the seated exercise. So now what we're going to do is we're going to have you stand up, Brian. So I'm going to make sure, I'm going to look at how Brian's breathing. I'm going to see any type of like body language or anything that would indicate he's too fatigued. I'm just going to monitor constantly. So what we're going to do is we're going to do a step and reach forward. So it's kind of like you're introducing yourself. So some of this stuff does look kind of silly, but it's going to help with your movement patterns overall. So we're just stepping and reaching forward. And then we're going to step with the right foot, same thing. Okay? So we're going to do 10 reps on each foot. All right. 1, 2, 3, 4, 4. Nice and big, Brian. Big movement. Good job. All right. 6, 6, 7, 7, 8, 8, 9, 9. Keep moving big, Brian. You're doing great.
Good work, DiCaprio.
Okay. So that was the step and reach forward. So now we're going to step and we're going to reach to the side. This is kind of like a fencer. So you're just going to go. Yep, just like that. And do the same to the left. Okay, so if you're ready, we're going to do 10 reps each side. All right?
Do you want me to alternate the sides?
Yeah, we'll alternate. So go right and left, right and left. Ready when you are.
All right. 1,
2. Just like you're fencing, you're about to put your sword in the air and there you go. Good job, Brian. So that's 5, halfway there. 6. 6. Nice and big movement, Brian. So that's 7. Brian, I'm going to have you count the last ones. I want you to
8.
shout them out.
8, 9, 9, 10, 10.
Good job, Brian. Okay, so we basically have 3 left out of the 7. Doing okay. Have any questions, anything you want to ask, or?
I'm good.
Okay. All right, so the next one, this one's a little bit trickier. We're going to go back. Our foot's going to come up. Gonna bend at the trunk, and our hands go back, just like that. Good. So it's kind of like you're almost about like to get ready to dive almost. So with this one, just be careful because you're going back and looking down. If you feel like you're getting dizzy or losing your balance, just take a break and make sure that you're kind of centered, okay? So we're going to do the same thing, 10 on each foot. So we're going to step back with the right first. That's 1. I'm going to go back with the left. That's 1. Okay?
Okay.
All right, ready? Right foot first. 1. 1. Try to keep your eyes forward. 2. 2. Arms nice and big. 3. 3. 4. 4. 5. Get those arms up there, Brian. Okay, so you count the last 5, all right?
6, 6,
Good job.
7,
Try to look up.
7, 8, 8, 9, 9, 10,
Good job.
10.
7.5 minutes.
Okay. So we have 2 left, Brian. So we're going to rock and reach forward. So this is kind of like walking, and then we'll kind of progress to actually doing this while walking. We're just stepping forward and reaching up. Okay? So that's 5, 6. Nice and big, Brian. It's rocking forward. So you keep your fists together at the beginning of that, and then you're just going to open your hands as you get to the end of your motion. Good job. And so then the last one, we're just going to rock. So our feet are going to stay planted here. We're just going to rock and go sideways. Yep. Go to the left. We'll alternate it left and right. Good job. Okay. And we'll do a couple more. Nice big movements, Brian. Good job. So that was the 7 tasks of the move big. As the patient progresses, we can add more to that. We can make it a little bit more challenging, and then we can make it more functional. So we can have them do walking, or we can have them do actual tasks that they would do similar to home, where they're trying to move big and recalibrate. Thanks a lot, Brian.
Thank you.